There's a kind of circulation problem that won't show up on any standard test, not in your major arteries, but in the smallest blood vessels in your body, the ones that feed your deepest tissues. When those tiny vessels fail to open properly, your tissues slowly suffocate, and that oxygen starvation becomes a major invisible source of pain. Let me show you what's happening at the microscopic level. I'm Dr. Padda. Back in our first episode, we touched on how high insulin damages the lining of blood vessels. This episode goes deeper into that idea, into the smallest vessels of all, your capillaries, because their specific failure is a distinct and powerful driver of pain that conventional testing almost always misses. Here's the distinction that matters. When people think about circulation problems, they think about the big arteries clogging, the kind that cause heart attacks, but there's a separate, subtler problem in the microvasculature, the capillary beds, the smallest vessels, where oxygen and nutrients actually get delivered to your tissues. These tiny vessels are supposed to dilate, to open up on demand, to deliver more blood where it's needed. Microvascular endothelial dysfunction is the specific failure of these vessels to dilate properly. Your major arteries can look perfectly fine, while at the level of the capillaries, delivery is failing. Now the mechanism, the endothelium, the lining of these tiny vessels, controls their ability to dilate. When that lining is damaged by the chronic hyperinsulinemia, inflammation, and oxidative stress we've discussed all series, the capillaries lose their ability to open on demand. So when a tissue needs more blood, during activity or during repair, the vessels can't deliver. The result is chronic ischemia, a persistent shortage of oxygen and nutrients in your deep tissues. And ischemic tissue is painful tissue. When muscles and nerves don't get enough blood flow, they signal distress. A deep, aching, sometimes burning pain. This is a well-recognized but frequently invisible source of neuropathic and deep tissue pain. Here's why this drives both patients and doctors crazy. The standard circulation tests are built to detect blockages in the large vessels. They are not designed to assess whether your capillaries are dilating properly in your deep tissues. So a patient can have significant microvascular dysfunction, real ongoing tissue ischemia generating real pain, and pass every standard circulation test with flying colors. The pain is genuine and the cause is genuinely vascular, but it lives below the resolution of the usual workup. The deep, aching, oxygen-starved quality of the pain is the clue if anyone's listening for it. The evidence is robust. Endothelial dysfunction in the microvasculature is well established in the context of metabolic disease, diabetes, and insulin resistance. We understand its link to impaired tissue perfusion and the role of ischemia in generating pain, including in conditions involving the small nerve fibers and small vessels, is well recognized. This is a real, mechanistically sound driver, hiding behind the limitations of standard testing. So if you have deep, aching pain and you've been told your circulation is fine, here's the nuance that may have been missed. Your big vessel circulation can be fine while your small vessel circulation is failing. Those are two different things, and the standard test only checks one of them. You weren't given a wrong answer exactly. You were given an answer to a narrower question than the one your body was asking. The right level was simply never examined. So here's our approach. We work to restore microvascular health by treating its root causes, which we err. The same metabolic foundation we keep returning to because endothelial function depends on controlling insulin, inflammation, and oxidative stress. As we heal the endothelium, the capillaries regain their ability to dilate, blood flow to your deep tissues improves, the chronic ischemia resolves, and that deep, starved, aching pain finally has a reason to ease. Our regenerative therapies further support healthy tissue and circulation. We're restoring the oxygen supply to tissues that have been quietly suffocating, addressing a cause, not masking a symptom. Tissue that can't breathe will hurt. When we restore flow to the smallest vessels, your tissues can finally get what they need. If your deep, aching pain has gone unexplained, this overlooked level may hold the answer. Go to painmd.tv and take the first step. I'm Dr. Padda. Let's look where the standard tests don't.